Hey, pretty friends. All right, ladies, listen up because this is really important. I am about to head into my oncologist's office where a trained professional is going to feel up my remaining boob. And that got me thinking how through my adult life I have really been relying on the trained professionals. My gynecologist, my breast surgeon, my oncologist. I've been relying on them to do a good job. And not that I wasn't doing my own self-exams and not that I wasn't taking them seriously, but I was certainly taking the medical appointments more seriously because these are the trained professionals. They know what they're looking for. They know how things are supposed to feel. But here's the problem with that. So I met this woman in a breast cancer group who discovered like a little slight change in the texture of her skin in a tiny spot on her breast. And so she went into her gynecologist who did a full exam and said, that's really nothing to worry about. Just go home. Don't worry about it. We can check it again in 6 months. And something deep inside of her said, no, 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 no. I need lab work done. We need to test this. There wasn't even a lump that was detectable by a mammogram. But she ended up being diagnosed with stage 3 breast cancer. Holy crap. I don't think I would have thought that. If the doctor said to me, oh, don't worry about it, that's nothing. I would just been like, oh, phew, okay, great. I just wouldn't have thought it. And I'm so impressed that she did. And, had she waited 6 months, that could have been the difference between life and death. So take it seriously because you are the person who knows your boobs better than anyone else. And the skin on your boobs. It's important. You are the person who needs to take charge of this. So really pay attention to any changes in texture, like dimpling or alligator skin, like dryness or scaling. Any changes in the skin on your breasts, that's huge important. Any unexplained nipple discharge, also huge important. Get your butt in there. You're not just looking for lumps. Oh, okay. I forgot what I was going to say. I wish that I had thought of this when I was breastfeeding my little guy. If you're a breastfeeding mama, of course there's going to be lumps, but you need to track them. And this is what I wish I had done. So, of course, I found lumps because I was a breastfeeding mama and there were lumps every single month, right? I mean, there's lumps every day when you're a breastfeeding mama. And I thought there was this one lump that was just a little bit odd. And I thought, okay, I got to check that again next month. But you kind of forget and you lose track and you don't know where it was and yada, yada. So here's what I want you to do if you're a breastfeeding mama and you've got lumps, which of course you probably do. Get a non-toxic marker, draw a dot on it or a circle around it, and then take a picture. Print it up, save it somewhere in a secure file on your desktop or computer or somewhere in your phone where your kids aren't going to find it. My kids are always going through my pictures. But save it and then do it again next week. Do the same self-exam. Any lumps you have, mark them with a marker, take a picture, and compare the two pictures. If that lump didn't move, get your butt in to see your OB. Please. I got breast cancer while I was breastfeeding mama, and I kind of ignored the lumps because, that's what happens when you're breastfeeding. You get lumps. And I just thought, when I'm done with breastfeeding, I'll go get a mammogram. But I ended up extended nursing, and so one thing leads to another, and you just sort of forget about it. And please don't do that. Take this seriously. All right, so I'm going to run in and see my doctor, and you guys all have an awesome day. Okay? Bye.